Hello everyone. We're going to talk about the elbow and forearm today. It's important to know some simple terminology when we talk about the elbow and forearm. You can see your Latin terms on the left, which will refer to some of your anatomy, and then what we would consider some of the names over there on the right, the upper arm, the forearm, things that we just kind of use colloquially in everyday language. The elbow is not super complicated when it comes to bony anatomy. It's a little bit more complex when we talk about soft tissue, but basically it is made up of the humerus, the upper arm bone, the radius, and the ulna. So the elbow is all portions of all three bones and is really a hinge joint. So the distal humerus along with the ulna makes up that hinge. At the end of it, end of that hinge, it kind of is a cupping type motion. At the back side of it, we'll see the olecranon, which is the bony part under the skin of your elbow. So you can see this right here. There's your olecranon. It cups with the, you can see here, it cups with the olecranon, the ulna. Okay, the humerus and ulna kind of cup together, and that makes the elbow joint. The olecranon is the bony part at the back of the elbow. So the elbow is held together by three major things. First is I want to tell you about the shape of the bone. You can see from that last image it was not very deep. Therefore, it has to rely on the ligaments, muscles, and tendons to really kind of keep it together to help connect the bone to bone and to make the elbow do what it needs to do, which is flex and extend. This is a backside or posterior view of the elbow. What you're seeing here is the olecranon at the very center of it. You see how it just kind of fits in that little, what we call olecranon fossa, that helps really kind of cup and keep the integrity, keep the bony congruity of the joint together. So just kind of look at those images, those parts of the elbow just for a minute there. But because there's not great bony congruity or bony integrity of that joint, we really rely tremendously on the soft tissue of the elbow. You can see the very complex ligamentous structure in the elbow. Like the knee, the elbow, which is also a hinge joint like the knee, has some collateral ligaments, which is on either side. The ulnar and radial collateral ligaments, so the medial and the lateral ligaments. They connect to the condyles, which if you follow the humerus down from the upper arm down towards the elbow, those are the bony protrusions that stick out of the side. And there's a smaller, lesser known ligament, the annular ligament, that helps hold the radial head, so this is your radius, helps hold the radial head in place with the elbow joint. This is an anterior view, kind of a cutaway. So in addition to the ligamentous security we have of the elbow, we also have some tendinous structures. Here we have some cutaways of the extensor, common origin of the extensor tendon and flexor tendon. Okay, so that's on the medial and lateral side of the elbow. We also see the bicep tendon, which again is off the front of your elbow. That's kind of a cutaway there. So really, it's a very complex soft tissue structure. Here we come back to that olecranon. That's your elbow. That's what you're resting on when you're watching this. Okay, that's the big bony area. There's not a lot of soft tissue padding it. It's really just that bony area, little layer of skin protecting. So the elbow joint, when we look at it, again, it has the radius, ulna, humerus. Around that area is that ligamentous capsule, synovial membrane that helps hold it all together. So again, you can see it's very, very supported by a ligamentous structural complex. Remember, it is a hinge joint at the elbow. The ulna and the humerus, they flex and extend. However, we do have some rotation, slight rotation, which makes it almost a ball and socket type joint at the radius where that radial head was. You saw that annular ligament between that and the humerus. But really, it's the elbow, true elbow itself is only capable of flexion and extension. Now, the forearm can be pronated, kind of palm down, and supinated, palm up. Okay, but that's based off the movements of the radius and not the true hinge joint of the elbow, which is the humerus and the ulna. All right, so we have two joints of the elbow complex. All right, we have the humeral ulnar. Okay, so again, humerus, upper arm bone, ulna, lower arm bone, major lower arm bone. Okay, so that's where it hinges, right there at the olecranon fossa. And then we have the radial ulnar, okay, which is right here. That's that pivoting. That was that annular ligament that helped that, and it's kind of, you know, a little bit of a slight ball and socket. But the true elbow joint is considered the humeral ulnar joint and is a hinge joint. All right, so it's only capable of flexion extension, the elbow joint. So the proximal radial ulnar joint is within the capsule of the elbow joint, kind of the envelope holding it all together. Again, the radius and ulna allows a little bit of rotation. Okay, keep in mind there are two joints of this radial ulnar joint. Okay, we have a proximal and a distal segment. Both joints are considered able to pivot due to the fact that the long arm bones rotate around each other, which we'll see shortly. Okay, but they rotate proximally up here, this little space. Okay, you kind of see this graphic, the schematic here on the right, how the proximal end of the radius rotates inside of the ulna. Okay, you can see that here. But now let's get to the muscles. Okay, muscles of the elbow are key for all these movements that are underlined here. Flexion, bringing your hand back towards you, extension, extending your elbow. Pronation, supination, which we use in so much of what we do. Think about when you turn your key to your car, you know, or turn the handle to a doorknob. That's pronation and supination. So we're going to look at all these muscles that you see here, all the B's, all the P's, tricep, the anconeus, and the supinator. So forearm movements, okay, we have flexion, okay. We bends the elbow, the three B's. You have the biceps brachii, okay, which is most active, most engaged when our forearm is supinated, so palm up, all right, but then when we bend our elbow. The brachialis, all aspects of flexion because of where it's attached to the ulna, all right, all aspects of flexion, whether your hand is pronated, supinated, or mid position, okay, which is thumb up, the brachialis is active, is engaged at that point. And the brachioradialis is most active when your thumb is up, okay, in that neutral position. So how do you find where the brachioradialis, how do you feel that? If you had your forearm thumb up and went to flex your elbow, so if you resisted your hand, like maybe put your hand under your desk and went to pull up, the muscle that pops up on the top of the forearm is your brachioradialis. So the really best way to find that is when your hand's in a neutral position and your elbow flexes itself. Some images of the brachialis and the biceps brachii. Okay, all the B's help flex the elbow. Brachialis, another B. So then we move to some muscles in the forearm that pronate or go palm down on your forearm. Remember, everything is from a anatomical position. All right, so if we rotate your hand so that your palm is down, those are our pronator muscles that are doing their job. Extension of the elbow, extension of the forearm. All right, the most powerful one we have is the triceps. Okay, that's the one that if we're doing tricep kickbacks, pushing ourselves up from the chair or the floor, pushing somebody away, our triceps is really doing all of that work. And it crosses the elbow and also crosses the shoulder. So it's a major extender of the shoulder and really of the elbow. The anconeus is a smaller, lesser known muscle, and really its only purpose is to get the extension movement started. Once the tricep is in a better position to take over, in a better mechanical position to take over, it will do so in the anconeus. It's just really just along for the ride. Okay. So you can see this image here. The anconeus is in the lateral, the outside of the elbow, and it really sits kind of over that lateral epicondyle area of the elbow. So that will contract, get the elbow extension movement started. All right, and then just behind it, you see the tendon of the triceps brachii. Once the elbow is in a better position, the triceps brachii takes over. So then we have your forearm pronation, forearm supination movement. You saw images a second ago about the pronator teres and pronator quadratus. But then you also have the supinator muscle, all right, and then also the biceps brachii. So supination is your screwdriver of muscle. Okay, so if you're tightening a screw with a screwdriver, your hand rotates to the outside, so then eventually your palm comes up. So those two muscles get your forearm to do that. All right, so when you pronate and supinate, when you flex and extend, I want you to practice these motions, practice these movements. All right, if you flex your elbow all the way back towards you, some of us have more flexion than others. One thing that inhibits this motion here is the bicep, the amount of muscle that you have getting in the way. So what we do is we call that soft tissue approximation. So when your elbow is flexing, if you have a larger bicep, you're not going to have as much range of motion as somebody with less muscle mass. So this is fine and dandy, all these muscles moving things around, the bony congruity and the shape of it. So, but when we're just standing there, there's a thing we have called carrying angle. And it's the angle, its purpose is for getting the elbow to kind of clear the body. And there's about a 10 to 15 degree carrying angle. Our elbows are not straight. So when we look at this, this is the angle. So because women typically have wider hips, their carrying angle, this kind of L shape that you see on this image on the right, is a bit greater. Okay, we measure it, okay, by drawing a straight line down the humerus, the upper arm bone, and a straight line through the ulna of the lower arm bone, and that angle is here. So somebody that maybe has larger hips has developed a greater carrying angle over time. Now, the funny bone, we call the funny bone, is really not a bone, and of course when you hit it, we know it's not funny. The ulnar nerve, okay, which is this yellow nerve pathway we see on the right, is underneath of the ulnar collateral ligament. It's between two bony prominences, the olecranon and the medial epicondyle of the humerus. And when we hit that, we actually have a little bit of a pain or numbness sensation down into the forearm, down into the hand. All right, so that numbness, that sensation, that area of unusual nerve conduction, this is where we feel that, right? We feel it down into the little pinky, maybe half on the ring finger, okay? Because that ulnar nerve will come down, and you can see again the yellow nerve on the left. That is what it innervates. So the other thing too is that if you lean on that nerve for quite a while, you may get some numbness and tingling here. If you've fallen asleep on an airplane and your elbow is your face, you're trying to keep your head up, You're leaning on that, the side of that armrest can push on the ulnar nerve down by the elbow, and you have a little bit of numbness and tingling when you wake up and finally land. However, we can also get traumatic issues to the elbow, in the area of the ulnar nerve, or injuring of that ligament. Okay, you can see these pictures. The elbow's under a tremendous amount of stress and strain. The ulnar collateral ligament is that complex on the medial side or inside of those elbows. So that can get torn. Okay, they can tremendous strain on that. The forearm muscles you can see on this picture's forearm, okay, is can be really stretched out as well. But then also too, because that nerve we just talked about, the ulnar nerve runs right through this area, we have some stress and nerve involvement there as well. So somebody that begins to have undue stress on the ulnar nerve can also feel numbness and tingling down into their hand as well. So I hope you've enjoyed this lesson on the elbow and forearm, a basic understanding of its anatomy, both bony and soft tissue, and some of the tremendous stress that can be put upon the elbow through our everyday activities. Thanks for joining me.